I'm representing myself here today, and I want to express my admiration for Emdeon for its pioneer entrepreneurial effort, and saying that believing that we expect Minnesota to be one of our initial clients. That's a fine way to look at your business. It's free market to do so. However, this is simply a new additional cost of healthcare. Who will pay for Emdeon services? Well, it could be a patient cost, it could be a provider cost, it could be a third party, it will certainly be a taxpayer cost. For a doubtful benefit, if the government intends to drive down a bad road, there will always be businesses willing to assist. And I think that this is a doubtful benefit that could come from this effort and expansion of government. And I think it needs to be rethought. But thank you for the opportunity to say so.
Thank you. Thank you so much. Okay, we are completed with the public hearing portion of today's meeting. Thanks to all of you who have provided testimony and comments today. Certainly, it's very clear, as if we weren't aware of it, that privacy and security issues are extremely sensitive and critical to the overall success of health information exchange, and you have certainly made your points well about how they affect those decisions that you personally, and the degree of carefulness that we need to build into our processes to maximize or minimize the risk of disclosure. Also, I appreciate the comments, Twyla, regarding perhaps we need to look at better ways of making notices more visible for future meetings. We are looking at possibility of having regularly quarterly meetings preset on dates in anticipation of other filings that will be coming forward. And we'll certainly work with MDH staff to see if we can improve that process, but your comment was appreciated. Also, again, thank you to the Emdeon staff. I don't know if I think you answered certainly the majority of the questions that came up, at least those that you were able to answer. I don't know if you have any final comments or questions, but we just need one final opportunity.
I just wanted to say thank you again for allowing us to have the opportunity to speak with you, and I commend what you're doing here. It is unique in the different states that we're operating in. You're not alone in the efforts that you're doing, but many states have not started taking the initiative that you are, and you're taking patient privacy and the ability to automate healthcare in Minnesota very seriously and personally, and I appreciate that. And our services and products become more effective and addressing your concerns when we do things like this. So I just appreciate the time, and I'm hopeful that I could answer most of the questions that Nathan and Tim and I, and if there are any additional, we'd be glad to address those as well.
Let me just one final or a couple final comments. Remember, as I mentioned earlier, that written comments are still being accepted for 5 days after the public hearing. Obviously, if there is a state government shutdown, that period will be extended. We will not, yes.
If we send those by email, will they get registered at least saved in somebody's computer until